Traditional therapy approaches often miss the deeper roots of our psychological challenges. But what if understanding your childhood experiences could be the key to transforming your mental health? Schema therapy is revolutionizing how we think about healing emotional wounds.
That's fascinating, especially since it evolved from cognitive behavioural therapy. What made Jeffrey Young develop this new approach in the 1980s?
Well, he noticed that CBT wasn't effective for patients with complex, long standing issues. It's like treating a deep wound with a band aid. It might help temporarily, but you need to address what's underneath to truly heal.
So how exactly does schema therapy dig deeper than traditional CBT?
Think of it this way: while CBT focuses on current thought patterns, schema therapy explores what I call our emotional DNA, these core beliefs and patterns that form in childhood. Research shows that these early experiences literally shape how our brains process information and emotions.
That's really interesting. Could you explain more about how these patterns develop?
So there are three main pathways, and this is where it gets fascinating. The first involves unmet emotional needs in childhood. Studies show that when children don't receive things like secure attachment or emotional validation, it can create lasting psychological patterns.
And what about the other pathways?
The second pathway involves direct early experiences, trauma, neglect, or even overprotection. But here's what's really mind blowing. The third pathway is about temperament. Research shows that up to 50% of our emotional responses are influenced by our innate temperament.
That's incredible. So how do these different factors manifest in actual schemas?
Well, they've identified 18 distinct schemas grouped into 5 categories. Let me break this down. Imagine them like different types of emotional lenses we develop. The first category deals with separation and rejection schemas. Studies show these are particularly common, affecting about 30% of people seeking therapy.
So what are some examples of how these schemas show up in daily life?
Let's take the abandonment schema. Someone with this pattern might sabotage relationships before they can be abandoned, even though statistics show their fears are often exaggerated. Or consider the emotional deprivation schema. These individuals might consistently choose emotionally unavailable partners.
That makes so much sense. How does the actual therapy process work to change these patterns?
The therapy follows a two-stage approach. First, there's a comprehensive assessment phase where they map out the client's schemas. Research shows this initial phase typically takes 5 to 10 sessions. Then comes the change work using 4 different types of techniques.
What kinds of techniques are we talking about?
They use this brilliant combination of cognitive, emotional, behavioral, and relationship-based interventions. For instance, schema journaling. Studies show that people who regularly track their schema triggers show a 40% improvement in managing their responses within just 12 weeks.
That's remarkable. What other techniques have shown strong results?
The imagery rescripting technique has been particularly powerful. Research indicates it can reduce trauma symptoms by up to 60% in some cases. They also use something called limited reparenting, where the therapist provides a corrective emotional experience.
And what kinds of conditions has this approach been most effective for?
The data here is really compelling. Clinical trials show an 80% success rate with borderline personality disorder. That's significantly higher than traditional approaches. It's also shown promising results with chronic depression, reducing relapse rates by about 50%.
Those are impressive numbers. How long does treatment typically take?
Studies indicate that most people see significant improvements within 20 to 30 sessions, though complex cases might need longer. But here's what's interesting. The effects tend to be more lasting than traditional CBT, with follow-up studies showing maintained improvements even years later.
That's really encouraging. What do you think makes it so effective long term?
Well, research suggests it's because chemotherapy addresses both the symptoms and the root causes. It's like treating both the fever and the underlying infection. Plus, it gives people practical tools while helping them understand their patterns on a deeper level.
Looking ahead, what developments do you see coming in this field?
The future looks really promising. Researchers are currently exploring how cultural factors influence schema development. Preliminary studies suggest that cultural context can affect up to 40% of schema expression. They are also developing specialized protocols for different populations.
That's fascinating how culture plays such a big role. Any final thoughts on the impact of this approach?
What really strikes me is how this therapy validates people's experiences while empowering them to change. The data shows that understanding our patterns doesn't keep us stuck, it actually makes us more likely to transform them. And that's really what healing is all about.